Before that, I have got a job to do that. 1 minute, 1 minute, 1 minute, we'll conclude it. And all four of you, I'm going to ask you very quickly, you tell me that. See, the topic is as experience, evidence, and guidelines. Now, guidelines is different from your protocol. You are asked to make guidelines. Are you going to put more essence of experience in guidelines or more of evidence-based medicine? Start with Dr. Balakrishnan. Quickly.
No, as I mentioned earlier, experience with evidence-based medicine is very important for the future.
That's simple. So you put 50-50 for the guidelines? 50-50? So Balakrishnan sir is going to be 50-50. Sir, Kotur, Dr. Kotur, please.
No, I already told my opinion about how the protocols or guidelines are evolved. I define my personal protocol, I evolve a departmental protocol, institutional protocol, then all combined together, then guideline, ISI guideline. But you think that guidelines will not have any the difference between protocol and guideline and regulations, You have to, the guidelines means, it involves evidence, it involves experience, it involves patient values as well. All combined together, then it is what is guideline.
Dr. Prabhakar, please. Guidelines, you are making guidelines. Will you put experience more into it or evidence-based more into it? No, you had to make experience, evidence and guidelines.
Like guidelines, in fact, in the name itself, they are only guidelines. With your experience only, you have to implement it according to this one.
Yes.
The circumstantial. Patient is also, you are not treating disease, we are treating patient with the disease.
60% science and 40% experience.
60-40, is it okay for you? And with that, Dr. Meenakshi is there, he love it. There is a saying, Tirukural, Epporul Yar Yar Vai Ketvinum, Apporul, Meipurul Kanbadari. So that we send the message to across. And thank you very much, ladies and gentlemen, for patient listening. Thank panelists, thank the organizers. Thank you very much. Thanks a lot.
Thank you, Professor Shekhar, for coordinating the discussion. And I would also like to thank the panelists, Professor Kotur, Colonel T.P. Prabhagar, Professor Balakrishnan, Dr. Venkatachalam, and all the other delegates who participated actively in the discussion. To chair the next session, I'd like to invite Dr. Hanumanta Rao. He's the Senior Professor and Head of Sri Venkateshwara Institute of Medical Sciences, Tirupati. He has more than 25 years of teaching experience. He's the MCI Inspector for Medical Colleges and also the Chief Mentor of Balaji Anesthesiology Postgraduate Update. He's also the editorial board member for Indian Journal of Anesthesiology. A warm welcome to you, dear sir. I now request you to introduce the speaker.
Good evening and welcome to this last session of the day. And I'm very happy to introduce Dr. Suresh Kannan, who is my close friend. And we worked together as senior residents back in 86, 87. He was 3 years senior to me. Very enterprising man. And he's going to talk on spinal cord stimulation and management of chronic pain. And currently is clinical assistant professor in the University of Central Florida College of Medicine, Orlando, Florida, USA. And consultant anesthesiologist and pain medicine physician in JLR Medical Group, Maitland, Florida. Fellow in pain medicine from Harvard Medical School. Teacher of the Year Award winner from Harvard Medical School, Boston. And member of American Society of Anesthesiologists and International Association for Study of Pain. So he's going to talk on a very interesting topic, spinal cord stimulation and management of chronic pain.